Blunt trauma in a child, diagnosis and management. Differential diagnoses. Systemic inflammatory response syndrome, SYRS. The presence of swelling, heat and pain, or tumor, calor, and dolor implies that the child may suffer from SYRS. Seeing that the patient is experiencing severe abdominal distension, bacterial translocations, and, particularly, bacterial peritonitis, can be considered one of the key factors affecting the child's current condition. The presence of Down syndrome may have contributed to the progress of the systolic murmur, since the disorder is viewed as the associated condition due to the presence of duplicated chromosomes, trisomies, which predetermine the development of the ventricular septal defect, VSD, and, thus, lead to the emergence of systolic murmurs. Child abuse, acts of commission. The atypical position of the epigastric bruising indicates that the child did not receive it from the fall. The circumferential marks on the child's wrists and ankles may be the aftereffects of rope burns, which means that the child must have been tied up. The identified information is sufficient enough to diagnose child maltreatment. Final diagnosis: blunt abdominal trauma. The protrusion in the abdominal area and vomiting combined with lassitude and loss of appetite are clear signs of blunt abdominal trauma. Since the child underwent post-atrial septal defect, ARD, repair and now suffers from postoperative congestive heart failure, CHF, rapid breathing can be attributed to POCHF. Abdominal pain, a protrusion in the abdominal area, epigastric bruising, a 10 cm hernia, vomiting, lassitude, and loss of appetite point to the presence of blunt abdominal trauma. Laboratory and ancillary tests. Computer tomography and focused assessment with sonography must be viewed as the key tests to be taken. The outcomes of the CAT test will allow for excluding the concomitant trauma from the diagnosis. As a result, the nature of the abdominal injury and its impact will be evaluated. CBC and urinalysis must also be viewed as a necessity. CBC will provide information about the patient's blood cell count and help evaluate the patient's abdominal cavity. The assessment must be carried out every 12 hours. Urinalysis, in turn, will help detect the possible presence of an injury to the urinary tract. Nasogastric tube placement is the ancillary test that must be taken in the specified scenario. It will allow checking for diaphragm ruptures. Alternatively, an oral contrast study, 1 to 2% ionic iodinated solution, will help determine the presence of any obstructions. Treatment plan. To address the patient's needs, one will have to consider 5 primary steps for initial resuscitation and stabilization. These include the evaluation of the patient's respiratory system, the introduction of a tool for monitoring changes in the patient's cardiac condition, the provision of oxygen supplementation to prevent hypoxia, and the use of tube or intravenous lines. Afterward, the assessment involving the use of the sample history and the active promotion of interdisciplinary collaboration between healthcare staff members must be conducted. Seeing that there are signs of possible child abuse, Child Protection Services must be contacted. Parent education. The mother must be educated about the importance of proper child treatment. The legal repercussions of child abuse, as well as guidelines for meeting the needs of children with Down syndrome, must be provided to the mother. Detailed information about the use of tools for monitoring the patient's state must also be administered to the mother. Finally, the mother must be instructed about the vaccination of the child. Self-assessment. The self-assessment process must include tests to help detect the presence of pain in the child. The mother's ability to manage the child's pain must also be evaluated. The mother has to be aware of the use of appropriate strategies for meeting the needs of a child with Down syndrome.